Hi, my name's Vanessa Hill. I work at East Point in the Community Relations Department, and we're going to be talking today about post traumatic stress disorder, or PTSD for short. So, when we think about PTSD, what does that even mean? So, it develops after a traumatic event that threatens one's safety or makes them feel helpless. So, people that develop PTSD, you can be the one that's affected. It could be someone you love, or it could be an event you witnessed. So, PTSD was first brought to our attention by war veterans, but they are not the only ones that can have PTSD. What are some traumatic events that can lead to PTSD? Obviously, war. Here in Wayne County, we know all about natural disasters with our hurricanes. After your house has been flooded and then you have a bad rainstorm, that can make you think about what just happened to you the last time it rained. Could be car or plane crashes, a terrorist attack, a sudden death of somebody that we love. Could be something that happens to us like rape or kidnapping, could be mugged, sexual or physical abuse, and childhood neglect. And we'll talk about that later. But when we talk about PTSD, when we're in danger, it's absolutely normal to feel afraid. That's what we should do. It's our body's attempt to prepare to defend against the danger or avoid it at all, take off running. That's our fight or flight response. But when folks have PTSD, this reaction is changed or damaged. So they're feeling stressed or in danger when there's no longer any danger around. So the difference between having PTSD and just a normal response to trauma, if you think about it, if something bad happens to us, we all feel afraid. Almost all of us experience some form or some of the signs and symptoms of PTSD because our sense of safety or trust are shattered. And when that happens, it's okay. We feel disconnected or numb. It could be that we have bad dreams, we're afraid. But for the ones that don't go on to get PTSD, the symptoms go away. What happens when you get PTSD, the symptoms don't go away. In fact, they can get worse. And we remain in that stuck position. And we can't move on. We can't face those memories or emotions. So it can come on suddenly, it can come on gradually, or it can come and go over time. And sometimes it seems to happen just out of the blue. And other times it's triggered by something. It could be a smell that we remember. It could be a sound. For the veterans that come back from the war, sometimes a car backfiring, thunder, fireworks, anything like that. And symptoms of PTSD can disrupt a person's life. It can make them hard to continue with their activities of daily living. Excuse me. So, what are the symptoms of PTSD? It's re experiencing that traumatic event. We can have flashbacks, we can have nightmares. Could be that we avoid the situation. We try to numb ourselves. We don't remember the important aspects of the trauma, but we lose just all feelings that we want to engage in normal activities. We can feel detached and numb. We may not think we have a future, so we may not think about getting a job or dating to get married because we don't think we're going to live that long. Could be increased anxiety and emotional arousal. We may have trouble falling asleep or staying asleep. Could be just an outburst of anger over nothing. It could be that hypervigilance, that we're always on alert and easily startled. So, what are the causes and the risk factors? Traumatic events are more likely to cause PTSD when there's a severe threat to our life or personal safety. The more extreme the danger is, the prolonged aspect of the threat, the greater the risk of us developing PTSD. And when there's an intentional human inflicted harm, it also tends to have more traumatic feelings than if it's like an accident or a car accident or a disaster, because we're so involved and we felt it so much. And the extent to which the traumatic event was unexpected or uncontrollable also plays a role in how we feel. So, some of the other things that happen, the more traumatic events that we experience, the greater likelihood that we're going to get PTSD. If you think about the employment of folks that have a lot of stress, think about the policemen, our emergency personnel, firefighters, any kind of emergency workers like that. It could be that we have a family history of PTSD or depression, that history of physical or sexual abuse, could be a history of substance misuse, a history of depression or anxiety, and there's usually a high level of stress in everyday living. Well, think about what we're going through. There's a lot of us that have a lot of high stress just around COVID, so we may recognize some of those signs and symptoms of PTSD. And the other thing is, what are our coping skills? If we have a strong support system, excuse me, after the trauma, that usually helps. When we think about PTSD, we talked about police and firefighters that had a higher risk factor, and obviously our veterans. But the people that suffer with PTSD the most are battered women or abused children. And you can think about that because of how long it's happened or how often. So, what do we do to treat PTSD? Could be trauma-focused cognitive behavioral therapy. That's talk therapy, that they gradually talk about the feelings and the situations that remind the person of the trauma. Could be group therapy, where we all get in a room together and talk about similar events that's happened in our life. For some people, it's a service dog. We all know how, if we love pets or animals, how helpful that can be. But for somebody that has that hypervigilant, a service dog can really help. Could be that we need family therapy, that we all talk about this as a group. And the other thing is, sometimes it's just so severe you need medication. So if I'm caring for somebody that has PTSD, how do I help? Obviously, we need to be patient and understanding. We are gonna be tempted to say, good grief, quit talking about it. You'll get over it. You just keep rehashing it. That's not helpful to tell the person that. And if we can anticipate the triggers, think about like 4th of July when we try to keep our pets inside. We are thinking ahead that what might happen. That's what we need to do with folks that we take care of too. The other thing is, we can't take the symptoms personally. If they're brooding, if they're quiet, if they're irritable, it doesn't necessarily mean we did anything wrong. They're just going through a difficult time. And the other thing that we don't want to do is pressure them to talk. That the more they talk about it, the more they'll get over it. Well, maybe not. Just some facts about PTSD. It affects over 20 million Americans every day. Women can be more vulnerable to PTSD than men because of the types of traumatic events that they experience, such as rape or domestic violence or sexual abuse. So people that have PTSD not usually, but they can have substance misuse issues too. And so what we need to think about too is, a lot of elderly adults can be victims of abuse by their children or their caregivers. Many traumatic events are never reported, especially by women. And if you think about it, the first baby boomers are going to start coming into long term care facilities, and those baby boomers are going to be veterans or victims of domestic violence. And we're going to see numbers like we may never have seen before because there's so many baby boomers. Again, if you know of someone that is suffering from PTSD or it's you that are having issues, please feel free to call East Point at 800 913 6109. They're there to answer the call 24 hours a day. And if you need brochures, if you need additional information, the library has some brochures on how to get help. We have cards that can tell you how to take a depression screening that is you can do it on your phone or on a computer. It doesn't have to be where anybody knows but you. And we also have a card that it's called My Strength. It's a free app and it's just about wellness. Thank you.